aphasia is pretty common immediately after stroke, but there is spontaneous recovery, natural recovery, months and weeks and months after stroke. And so the type of people and the type of aphasia that we work with is chronic aphasia after months and years after stroke. And the prevalence of that is relatively low, but we know that currently in the US, there are about 2 million people that have that residual long lasting aphasia into their years and years after stroke. So it is pretty common. It does have catastrophic effect. It impacts everyday communication. So oftentimes people are not able to go back to work. They're not able to communicate with their loved ones in the way that they used to. So it does really impact their day-to-day life. And people tend to think of stroke and physical disabilities, not being able to move their arms and their legs and not being able to walk. But you can imagine that not being able to communicate and talk could have really lasting effects. And we've had patients who come to us, and when we ask them, what is it that you would like us to work on? And between physical disabilities and these hidden sort of language disabilities, people often say the language disabilities can be pretty catastrophic and pretty life-changing. Um, and you can imagine that not being able to communicate could, you cannot advocate for yourselves. You're not able to um, share what your experiences are with aphasia. And so it becomes a really challenging disability.